Vulnerable populations can include women and children, ethnic people of color, gay and lesbians, HIV and chemically dependent people, and homeless people. These groups experience greater disparities in respect to health status, secondary to factors such as low socioeconomic status and lack of environmental resources. The homeless are considered vulnerable populations because of their lack of environmental resources and decreased access to care. Homeless individuals are defined as persons without permanent housing. They may live on the streets, an abandoned building, a shelter, a mission, a vehicle, any place that is considered non-stable and non-permanent. Let's look at homelessness by the numbers. According to Opening Doors 2010, at any given point in time, there are at least 643,000 individuals in the United States who are considered homeless. That leads to an estimated annual amount of greater than 1,585,000 people in the United States who are homeless. The staggering part of this statistic is at least one-fourth of these individuals are our nation's veterans. Disparities in access to health service affects individuals as well as society. Limited access to health care impacts one's ability to reach their full potential and leads to negative outcomes. The homeless experience multiple health disparities and have an increase in chronic medical conditions, which includes things such as liver disease, HIV/AIDS, hepatitis, hypertension, coronary artery disease, and diabetes. The homeless also have an increased risk of substance abuse and mental illnesses, which include diseases such as post-traumatic stress disorder, major depression, bipolar disease, and schizophrenia. Despite poor health, the homeless rarely participate in primary care and ongoing care of their chronic medical problems. The mortality rate for those experiencing chronic homelessness is 4 to 9 times higher than the general population. The average lifespan of the homeless person is shorter than 45 years, and on an average, homeless adults have 8 to 9 concurrent illnesses. This leads to chronic medical problems that are uncontrolled and difficult to treat. Let's look at the cost of care. The homeless are frequent users of emergency department. They visit on an average of about 5 times per year. Each visit can cost about $3,500, which leads to an annual cost of about $18,500 per homeless person. Also, because they have chronic illnesses which are often uncontrolled and untreated, when they are hospitalized, they have extended hospital stays. On an average, they stay in the hospital an extra 3 days than someone who has stable housing. That adds about $9,000 on top of hospital stays. 80% of the emergency room visits that are made by the homeless could have been prevented with adequate preventive treatment. This adds an unnecessary burden to the entire healthcare system and society as a whole. The homeless do not have means to pay for these hospital care costs, and these costs are carried over to the community as a whole. Also, when the homeless are in the emergency departments and hospitalized for conditions that could have been taken care of on an outpatient basis, this takes up necessary room for people who are experiencing true emergencies. The homeless experience many barriers. They have lack of transportation and lack of stable housing. This leads to difficulty in them participating in their own self-care. They also have increased incidence of substance abuse and also mental illnesses, which further poses a challenge for the primary care provider in attempting to help maintain their healthcare status. They also face the stigma associated with being homeless when they enter the healthcare system. Establishing of a primary care center in the homeless shelter will help alleviate some of these barriers that are experienced by the homeless. The population that I plan to focus on are homeless veterans. My clinical question is, how effective is integration of primary care into an existing homeless veteran program, the Safe Haven, in reduction of emergency room visits and improvement of health outcomes? The VA has a portfolio of programs designed to assist low-income veterans or veterans who are experiencing homeless. The 3 areas of focus for serving these veterans include outreach, treatment, and prevention. These 3 areas and the programs that are within these areas work together with VA benefits and healthcare services to provide support for those in need. The implementation of the Safe Haven model was in response to President Obama's challenge to end homelessness in veterans by the end of the year 2015. The Safe Haven model is a person-centered approach for veterans who have an increased incidence of substance abuse issues and also experience mental health issues. The Safe Haven is a 24-hour, 7-day-a-week, community-based early recovery model of supportive housing, and the veterans also are able to undergo treatment for their substance abuse and mental illness. The Safe Haven model was patterned after an integrated primary care and homeless service care model. This is where primary care is integrated into a homeless shelter in order to meet the needs and specific challenges of homeless veterans. Research has shown that implementation of this primary care homeless service care model has been able to reduce emergency department use by up to 40%. It's also been shown to reduce hospitalizations by 30 to 50% and improve chronic disease management outcomes. The Safe Haven shelter opened up in Shreveport in January of 2014. It currently does not contain a primary care clinic component. My interdisciplinary plan is to integrate a primary care clinic in the existing Safe Haven shelter. Implementation of a homeless veterans primary care clinic in the Safe Haven homeless shelter will ensure barrier-free access to care. This will allow the veteran who normally fails to participate in ongoing care to have their primary care and acute care needs met in their own environment. The clinic will be staffed Monday through Friday during the hours of 7:30 a.m. to 5 o'clock p.m. The staff will consist of a nurse practitioner, a registered nurse, and clerical staff. The veteran will receive an initial intake appointment and ongoing primary care and urgent care appointments. An on-call staff will be available 24 hours a day to perform telephone triage, and these veterans will have full access to all services that are available at the VA Medical Center. A dietitian will be consulted and will visit at least once a week and schedule appointments and perform educational classes as needed. The veterans will be transported to the medical center for any diagnostic tests, any specialty clinic appointments, and to receive any medications or any other treatments that may be needed that cannot be performed in the Safe Haven clinic. Collaboration with the disciplines will be performed through the use of the electronic medical records to ensure that these veterans receive high-quality health care. Stakeholders are defined as people, groups, or organizations that have a direct or indirect effect based on the actions of the organizations. Who are the stakeholders in this prevention project? The number one stakeholder is the Veterans Affairs. They have been challenged to reduce or eliminate homelessness by the end of the year 2015, and they are motivated and have made positive steps in that direction. They will definitely be an important part of this prevention plan. Another group that's a stakeholder in this plan is the homeless program. This program has multiple programs that are already in existence in order to help reduce homelessness in veterans. They indeed have a stake in this plan because success of this program will lead to success in the program as a whole. Another group who is a stakeholder in this plan is the Safe Haven Homeless Shelter. Through the integration of primary care into the Safe Haven program, this should improve compliance of the veterans who are in this homeless shelter and also allow more stability to their substance abuse and mental health issues. The other stakeholders in this plan are the support staff that are needed. Based on the fact that this homeless shelter will have full access to all VA resources, the support staff that are needed would include podiatry, the dietitian, specialty clinic, pharmacy, physical therapy. All of these support staff are very important in the success of this Safe Haven homeless shelter. The most important stakeholder in this project is the homeless veteran. They indeed are the major stakeholders and will be impacted the most by the success of this program. What are some potential challenges of this primary care prevention plan? A major challenge in any program is funding. The VA was recently awarded $1.6 billion in response to the challenge to end chronic homelessness in veterans by the end of the year 2015. Based on this funding, the Safe Haven model was established here in Shreveport. The Safe Haven shelter has adequate funding to sustain the program for the next 5 years. A second potential challenge is participation. Normally, the homeless have competing priorities, and healthcare is at the bottom of their priority list. Because these veterans are in stable, structured environment with the goal of permanent housing stability, they're better able to focus on their self-care. This should improve compliance and also improve participation in this primary care clinic. Resources are another potential challenge. Because this structure is already available and I've surveyed the area and there's adequate space to implement primary care into this existing structure. Also, because we will have access to the VA center, this of course will ensure that we have adequate resources in order to provide the primary care to these veterans in this primary care clinic. How to measure the effectiveness of this plan? I will focus on 3 different areas: client participation, compliance rate, and reduction of ER visits. I will do a retrospective analysis of the participation, the compliance rate, and the ER visits in homeless veterans who are in traditional primary care and compare those to veterans who are enrolled in the primary care homeless clinic. I will obtain data from the electronic medical records in order to compare this information. Based on my literature search, I should see better outcomes. With implementation of the homeless primary care clinic, I expect to see, with the increase in access to care, a reduction of ER visits, a decrease in hospitalization, improved control of chronic medical problems, increased compliance, and this all leads to improved cost savings. Technology is an important part of this prevention project. The VA hospital has utilized electronic health records since 1990s, and they've shown to improve the quality of the clinical care with the use of the medical records. The electronic health record system will be utilized in this primary care clinic. Also, the VA has an automated reminder system in place, and this is where the veterans are telephoned 1 to 2 days prior to their appointments as a reminder system. Also, the use of email and text messages may also be utilized in this prevention project. The literature shows that 40 to 60% of homeless people have access to a cell phone, and this may be a way to improve their compliance and also improve their health outcomes.